Recording in progress.
Okay, so we're recording now, so that's good. Max, make you the host again.
Do I need to make John the host after I?
Yep. Oh, well, you want to make John McDonald host, yes, after.
Yeah, John McDonald host. Okay, yeah, okay.
The Bassett Design event is happening now at Huck Ben Home. Save up to 40% of Bassett's most popular collections, including Beckham, Allure, and more.
So it's 6:30.
Okay.
Max, the floor is yours.
Yeah, well, let's go ahead and get started, and people can join as they get here. I'll just start with a very brief shout out to a couple of people. First of all, our, if not fearless, at least very brave Saratoga County leader, Martha Devaney, our committee of our for the county Democrat, and I also see I don't see a couple of others I was going to mention, so maybe I'll wait for a minute or not say it at all. But I do want to thank my two associates in this project, Tony and John. Tony has it was Tony's idea to do this. I wanted to do this with Manita Sangvi a couple of years ago, and just couldn't get it together. So it's a real privilege when Tony suggested it. I shot John an email, and as he always does, he answered within an hour or two. I have never had a more receptive representative anywhere I've lived, of all the many places. And it's not just that he answers within 2 hours. So my compliments, John. Anyway, John answered back very quickly and said that he would love to do it. I almost feel like quoting his email, that he'd love to do it because people need to know this. And that just absolutely confirmed what I think, because we've had after a long period of almost no committee in Waterford, we've had a bump in growth and a bump in energy, and it comes from fear. We don't want to live in a police state. We don't want to live in constant chaos. We don't want our economy to go south and for all of our services to go away. So anyway, it's a real pleasure to be here, and I'm going to turn this over now to one of our newest members, John Lacombe, and just a real brief introduction for John. John is our secretary now, and he comes to us from Waterford, one of our legacy families here in Waterford, Lacombe. But he comes to us. He moved away. Did a stint in the Army, I believe it was the Army, but lived in Alaska and then got educated in Indiana, and came back home and is now a teacher at Waterford High School. And so we're very proud to have him involved, and we're proud to have almost anybody who's not a septuagenarian on our committee. It's really nice to see somebody that doesn't have a gray beard yet on the committee. So anyway, I will turn it over to John, and we have written questions, and we're going to take other questions. So anyway, John, I'm going to make you the host now.
So we have gathered just a quick format for everybody. This is our first time doing this, and I just want to make sure that everybody is on the same page. We have gathered a collection of questions from those of you that have registered. We will call on the person that submitted to ask their question, and Tony will be waiting to unmute you. If the person attending is not present, I will be ready to read off the question. A few ground rules. Please try and keep your questions as brief and concise as possible. We want to get to as many of them as we possibly can. Additionally, we want you to feel free to express your anxieties, your angers, and your frustrations, but please remember that Assemblymember McDonald has graciously volunteered his time to be here, to answer your questions, and to be cordial and to be respectful. If you did not get the opportunity to ask a question to Assemblymember McDonald, you may type it in the chat. Tony will be monitoring, and we may call on you to ask your question. And again, just be mindful. We want to try to get to as many of your questions and concerns as possible. With that, I would like to introduce our special guest, Assemblymember McDonald. John McDonald has served in the New York State Assembly, representing the 108th District since 2013, which consists of parts of Albany, Rensselaer, and Saratoga counties, including the city of Cohoes, his hometown, where he previously served as mayor for 13 years in the communities of Green Island, North Greenbush, East Greenbush, Rensselaer, Waterford, and the cities of Troy and Watervliet. John is a member of the following New York State Assembly committees: Alcoholism and Drug Abuse, Health, Higher Education, Ways and Means. John focuses on his strengths in local government, healthcare, and small business. John has sponsored and passed legislation into law to reduce unfunded mandates to local governments, control the cost of property taxes, support job growth and workforce development, strengthen access to healthcare, and address the opioid crisis. Wow, that was a mouthful. John, thank you so much for being here, and I'd like to give you an opportunity to introduce yourself.
Great. Well, John, thank you for the introduction. Max, thank you for reaching out. And Tony or TJ, thank you for being the man behind the screen. You're going to coordinate all of this, I think, and make it work. And thank you for the idea. And to all those on tonight's, I guess we'll call it living webinar, thank you for taking time. Obviously, there's a lot to digest. What I'd like to do, if I could just take maybe 5 to 10 minutes, we had a briefing from our Ways and Means chair and leadership about a week ago. It was last Friday, matter of fact. And what I'd like to do, and I'm just going to run through a couple high point issues on what I call HR1. That's actually what it was. That's what its name is. As you know, some people call it the big, beautiful bill. Some call it the big, bad betrayal. You know, I think I will tell you by the time you're finished with this, you're going to probably agree with the latter. But at the same time, you know, like I said, I want to share some facts with you and go from there. If I had to sum up my overall upset and concern, because there's a lot of areas to get upset about. As one of the few healthcare practitioners, I am extraordinarily concerned about the impact it's going to have on healthcare. Just when we were making a difference and getting to the point where 95% of every New Yorker had some kind of health insurance coverage, this act alone is going to take us back before Barack Obama was president. No ifs, ands, or doubts about it. Interestingly enough, it's done in a way that most of the financial impact won't be felt until after next year's midterm elections. However, I think that's something that we need to be very much mindful of. And the other aspect is, from a fiscal responsibility person, you remember I've run a business for 40 years, ran a city for 13 years. This, you know, technically, the party in leadership now has always historically tried to associate themselves with fiscal responsibility. And I would argue this is probably one of the most fiscally irresponsible actions I've seen in a long, long period of time. The deficit by the Congressional Budget Office, a nonpartisan group of individuals paid to actually validate the numbers, shows that our deficit will increase by $3.4 trillion over the 10-year period, starting now and ending in 2034. That's an additional $10,000 per person that each one's going to be picking up. And that means that deficit now is over 30, the actual national deficit is over $36 trillion. That is something that is hard to imagine. The things that people talk about, if you're supportive of the bill,
James, what's wrong?
I'll share this just because there are a couple of decent things in there. They're not great, but it could have been worse. You know, there were, if somebody could, if you guys could all mute yourself while until we ask questions, I'd appreciate it. There were, back in 2017, the Tax Cuts and Jobs Act did lower individual income tax rates at the lower end, and those continue on. The problem, to be very clear, is at the top echelon, the people who are making hundreds of millions of dollars per year, they continued that tax reduction, which arguably is something that could have been sunsetted to help reduce the deficit and also reduce the impact of these cuts. As you know, New York State is a state that has some significant local property taxes. There was a cap of $10,000 put in, which forced most people just to do a regular tax filing versus to do the short form. That cap is going to be increased to $40,000, but it's for certain taxpayers with incomes below $500,000 through 2029. So it's a short-lived increase on that cap. The question is going to be is it really going to make a difference in what people's total taxes are going to be? There's a couple what I call shiny white objects of tax provisions approved that some people will think, oh, this is great. For example, a new tax deduction for up to $25,000 on tips for those taxpayers with incomes below $150,000 or $300,000 for joint filers. And that's through 2028. So it's only a short-lived deduction. But to be clear, and I talked to the restaurant associations about this, I've talked to tip workers. A lot of them have never really actually claimed those on their income tax. So they're being promised a deduction that they're not going to be able to achieve. I guess the only good thing is it's not one that's going to have a financial impact on the $36 trillion deficit. There is a tax deduction for up to $12,500 on overtime pay for certain groups of taxpayers with incomes below $150,000, $300,000 for joint. And the standard deduction, which now is $15,000, moves up to $15,750. What is troubling to me is that I am an individual. If we could please mute, please, that would be great. Or maybe, John, maybe you can mute everybody. That would make it easier. What's troublesome to me is that, as you know, we have an energy challenge in this country. We need to provide more affordable options for energy. We need to make sure that we're looking at every single option on the table, particularly in the clean energy or green energy field. And unfortunately, as much as there were very good green energy tax credits established in the Inflation Reduction Act, particularly for wind and solar and for battery storage, a lot of those are now being repealed or scaled back significantly, which is not good. One area that really may not bother you much, but it bothers me significantly as a healthcare professional, and this is not a direct healthcare issue, is that they decided to go after student loans. Now, usually we go after student loans to help the borrowers. This, in fact, hurts borrowers going forward. They've put in new caps, particularly at the graduate level, at $20,500 annually and $100,000 total for graduate students, or $50,000 annually or $200,000 total for professional students. What does that mean? I'll give you a good example. Many communities, urban areas, rural areas, but even suburban areas are struggling to attract individuals to work in the as doctors and nurse practitioners and nurses in their communities. By putting a cap on these student loans, it's going to produce less and less doctors, particularly for our underserved areas, in the minority communities, Hispanic communities, urban communities. I think it's actually sinful what's happening. And listen, I'm not all for just borrowing to the hilt, but the reality is this: these medical programs run 8 years sometimes, depending on the specialty or the field. That is going to be problematic in regards to trying to address what is already a workforce shortage. The federal government is now running away from the SNAP program. New York State is going to have to assume a 15% share of SNAP benefits. SNAP is to provide food and support programs, nutritional assistance programs. We are going to be assuming another $1.1 billion to continue to maintain that program. And we will assume another 25% in administrative costs, which is $266 million, of which unfortunately some of that, prescribed by federal law, will be passed down to local governments. There is a work requirement, which is interesting because I know I can tell you as a healthcare professional, most people don't choose to be on Medicaid. Unfortunately, they have healthcare issues that come up. They have challenges. They have parental responsibilities. And they're going to be trying to put in workplace requirements, which, interestingly enough, and this has been proved out in red states like Georgia, the amount of money and effort to oversee a program like that usually doubles or triples whatever the expected savings is going to be. So this might be chasing after, it might be a fool's errand in many aspects. They have suddenly overnight changed the definition of what has been eligibility standards for people to receive health care, particularly in the immigrant community. In the past, for the testament of time, since Lyndon Johnson established this, refugees, asylum seekers, and human trafficking survivors were eligible for SNAP benefits. Now they are no longer eligible for SNAP benefits as of 1/1/26. The same type of thing carries on in regards to healthcare. From the healthcare perspective, and I'll try to stop here, and I really want to hear more of your questions and hopefully provide you some challenges. The interesting, tricky thing with the healthcare changes is they don't make the changes effective to January 1st, 2027. That's after next year's midterm elections. They do make some changes for next year that all lawfully present immigrants below 100% of the FPL are ineligible for the premium tax credits. What's going to happen is many undocumented immigrants who are taxpayers, who actually have a taxpayer ID number, who have taxes taken out of their paychecks, are going to lose health care that was affordable. We're going to also have many hardworking New Yorkers who are not undocumented immigrants. They are U.S. citizens. They are New York residents that are going to have to, in 2027, start to pick up their healthcare costs that they used to qualify under the essential plan, which was established when Obamacare was approved several years ago. That is going to have one of two effects. Number one, for those who were able to have free or reduced cost health insurance, now they're going to have to buy a regular policy, a commercial policy, which easily could add $600 to $800 a month out of their paycheck. The other thing is some people may go at it without health insurance. And what that means is that our hospitals and healthcare facilities throughout the state of New York will probably see an increase in their uncompensated care. At the end of the day, if I show up at an emergency room and I need care, they have to provide it to me, whether I have insurance or not. And they can chase us for bad debt as long as they want. If somebody can't pay it, they can't pay it. And that is going to basically lead to a diminution of services in the hospitals, or it's going to lead to closures of hospitals. I don't think here in the capital region, I see that to be the major concern, but when we move further up north of Saratoga and moving up to the Canadian border, we're going to see hospitals. I know hospitals and federally qualified health centers are going to struggle to stay open. I know that because they've been calling me. I don't represent that part. When they say Saratoga County, I have good old Waterford, which I'm happy and honored to represent. But I'm also happy and honored to work with my friend Carrie Werner to represent the interests of Saratoga County. But when you look up into it's Congressmember Stefanik's district, it's going to be terrible. It's going to be absolutely terrible. And healthcare is really going to struggle. And the last thing the North Country needs. I think there's some other dynamics that are kind of in the weeds. Maybe those questions will lead to it. I don't want to dig too deep. I'd rather, as most of you know, I'm a pharmacist. I love to get people's questions and hopefully to give them answers. So with that, John, I guess, or TJ, whoever's moderating, let's open up the flume.
Our first question is going to come from Martha Devaney, who we are pleased to have here from the Saratoga Democratic Committee.
Hi, everyone. Thank you so much, Assemblymember McDonald. It's great to see you again. Always appreciate your time and addressing the constituents, your constituents, Saratoga County and beyond. My question, and recognizing you as an expert with healthcare, has to do with the New York Health Act that has been with the legislature for several years and has not, I believe, gone to conference and has not advanced. Recognizing the deficit that New Yorkers are facing with healthcare, I'm wondering if you can comment on, I guess that's a two-part question, the status of that and its likelihood of being advanced. That's the first part. Second part is what we can do to support that effort to ensure that the New York Health Act advances, and the New York Health Act is a single-payer healthcare bill that's been in the legislature.
Well, Martha, first of all, thank you for your leadership for Saratoga County. I know sometimes for the Democrats in Saratoga County it can be a little bit lonely, but you're doing a great job of building that group, and that's important. In regards to the New York Health Act, as you know, Dick Gottfried was a champion for years, and it's still in committee at this stage of the game. The interesting dynamic is there is a school of thought that this would be the direction to go, and I'm not opposed to it by any stretch of the imagination. We have a couple obstacles we need to be considerate of. First of all, organized labor. A lot of the labor groups are opposed to it. And the reason being is that throughout the generations of time that organized labor has been at the negotiating table, whether it's at the local level, whether it's at the county level, whether it's at the state level, they've actually negotiated over years to have a defined healthcare plan that is actually, quite generous. And they are very concerned that without having the finer details, they'd be giving up something they negotiated for. So organized labor has been actually the biggest, not all organized labor groups, but a lot of the big ones. That's been one of the biggest problems. The other dynamic, which I'm being told, but it hasn't been clarified, for a workaround, in order for us to do this, so we can leverage federal funds, is we need a federal government to support us. And so then the question is, do you believe the federal government is going to support New York State on anything? I mean, what people don't realize is New York State has been, except for maybe 1 or 2 years in the last 50 years, been the biggest donor state to this country. We send more money to Washington, D.C. in total and per capita than any other state in the country. And meanwhile, so we'll send $1.15 for every dollar we get from the federal government. And the controller does a great job of putting out these numbers each and every year. We only had 1 or 2 years, and it was during the COVID years because we were so hit by this so early that we actually came close to being even. But we are basically we're paying for healthcare in Alabama and Arkansas. Doesn't make sense by any stretch of the imagination. So to sum up on your question, we need federal cooperation and we need labor to get on board. And I think we need to do a better job with trying to clarify those positions and try to get the unions to jump in. But thank you.
Thank you. May I do a follow-up on that, which is at one time, several years ago, I was part of the lobby days in support of the New York Health Act. And I was asked to please, with the group I was working with, to show the cost savings and the actual dollars and cents to this bill. And if you do the numbers, and there are several models to follow, it's a tremendous cost savings, both to our municipalities and our school districts. And I'm thinking that might be a compelling incentive for labor as well as to garner other support, because we need to, capitalize, no pun, on cost savings whenever and wherever we can. And this particular act represents a huge cost savings for those in New York.
The cost savings you speak to, Dick Godfrey, to this day, he still sends me emails, is mostly focused on the fact that technically this will eliminate insurance companies and eliminate their what is considered to be their fat or their take of the pie. Now, I think that needs to still be continued to be fleshed out. And I think I can say this candidly, there's a big difference between a nonprofit health plan like a CDPHP or an MVP or a Highmark and the major commercial ones that are traded on Wall Street, such as Aetna, Cigna, and United Health. Personally, I said to Dick years ago, if you really want to make this happen, we should work with the non-for-profit health plans because we actually control what their administrative costs are going to be, so we can really get some significant savings. But Martha, I think those numbers have been bandied around, and I don't want to question them by any stretch, but they need to be validated. That's a good point.
Thank you.
Our next question is going to come from local Waterford Democrat, Quincy Renee. You may ask your question.
Need to unmute.
I'm there. I was just asking a stupid question. What happens if New York State, given the government taking all this money and stuff away from us, decides not to pay taxes from New York State to the government because we need to make up the deficits that they've left? Now, that's a dumb question, but I'm sorry. That's what
No, it's not, Quincy, it's not a dumb question. Matter of fact, that question is actually in the format of a bill. My colleague, Michael Asher from Manhattan has introduced a bill along that lines. This follows along the same avenue that the state of Maine has taken. And, one of the questions that inevitably come up is, what are you guys going to do about all this? And that may be one of the things that we push for to see if we can somehow figure it out and try to continue to blunt the draconian impacts of HR1. Not a stupid question. It's a good idea.
Thank you.
The next question we have came from Donna Mackey, who does not appear to be here at the moment. Donna, are you here unless I'm not seeing you? Oh, her question was the property tax cap lifted from the $10,000 tax deductible limit? You already touched on this, but you can talk. Can you talk a little bit more about how that change is going to impact kind of your average upstate New Yorker?
What she's asking about is the state and local tax cap. In other words, you can only write off up to $10,000 in property taxes. Technically, this is supposed to be a win. Now you can write up to $40,000 in property taxes. Honestly, the people who are, I don't know about you, but my property taxes don't even get over $10,000. So, and I have a very big house, but that being said, there's parts of the state where people in Westchester and Long Island particularly, and Westchester pay astronomically, they have very, very high property taxes. They're probably in the $20,000 or $30,000 range. So there'll be a cap at $500,000. That's only temporary. So do not be fooled by saying that we got rid of salt. They didn't get rid of salt. They just went salt light.
Max Kintner, you are up. You can ask your question. Max?
Okay, I actually had several, so I was just looking at them. But if you could, I would like to hear more about the Senate bill from Senators Ramos and Lasher. How would that work? Now, I don't have any idea how the federal government collects tax money, so I can't speak to how the state would step in and keep some of it. And that's just not clear at all to me. And I believe that you sponsored or maybe even introduced a similar bill in but more limited in the assembly. Is that correct? I saw you on New York Now saying that you endorsed Jessica Ramos's bill.
Oh, I support the bill. I support the bill. There's no doubt. I did not, for those, this is legislative 101. There's the chief sponsor and then there's the co-sponsor. So if you're not the chief, then you want to support it, you become a co-sponsor, which I do support. Now, and the interesting part is, to your point, the mechanics haven't exactly been worked out. But one way we can do is hold back some of our money that we're supposed to send to the federal government and try to get to an equilibrium to blunt the impact.
Okay. Yeah, I assume that would involve lots of lawsuits and stuff.
Yeah, it'll be litigated for a period of time. So, once again, the mechanics are not there. One way of doing it is where the state intercepts all federal taxpayers' money going to the federal government. I don't know how that works mechanically. I know whenever I pay my taxes, it says right to the United States Treasury and you mail it. But we like I said, you gotta throw some items out there to get people's attention and let people know that this is wrong. It's just dead wrong. I have to reiterate, New York State is the largest donor state in the country. We support many other states, and other states are benefiting from this federal tax change, but not us.
Andrew McAdoo, are you able to unmute and ask your question?
Yes. Thank you. Can you hear me?
Yes, we can. Hi, Andrew. How are you?
Okay. Hi. First of all, thank you very much for taking your time to have this Zoom. My question is related to why should New York State taxpayers bail out the MAGA counties that Stefanik represents? So I don't want to see anyone lose health insurance or go without health insurance. But I really believe that at some point, these rural New York counties should begin to reap what they sow, by supporting them. And what happens is that New York State government ends up mitigating the damage done by Stefanik. But if I may, and I understand there's no real answer for that, but I really hope that that's something that can be considered. But I have to ask a follow-up regarding the unions, because I've had several conversations with NYS and other unions who oppose the New York Health Act because of the reason you described. Prior to retirement, I managed an independent telephone company with 50 employees, and we transitioned away from post-retirement healthcare benefits. And there was some other incentives and trade-offs, but the key is this: that we had an actuary and the insurance company put a dollar value on those. So to me, they're not, you simply, if it costs you $10,000 a year for those post-retirement health benefits, then an actuary can tell you what the value of that is. And that's simply a dollar amount that is budgeted in a compensation that would be due to them in another way.
No.
I have never, it is completely illogical, that argument. They're not losing anything. That is a negotiated amount of money that they could be used in another way, possibly increased cash payments. So anyway, those are my comments, and I want to thank you.
Thank you, Andrew. And you raise a reasonable option. Now, the interesting dynamic is that and I've negotiated with unions for 13 years, and I've worked with them for the last 13 years in the assembly. Sometimes it's difficult for the leadership to convince the rank and file that this might be the best route to go, because you got to remember, for all those years they're negotiating the contract, leadership was coming back saying, "Look what we got you," because we we wanted to protect your health insurance, and to basically do an about face, however, with compensation is something that, once again, to my earlier point, we need to run the numbers more exhaustively where everybody can look at them and judge them on their own basis. And on your first point on regards to the red counties, it is extraordinarily disappointing that 7 majority members in our congressional delegation voted to support this bill. And quite frankly, the voters in those districts need to know that, and they need to let their membership know. And they can let them know now, or they can let them know in November of 2026, one way or the other. But this was basically turning your back. I mean, in regards to the Congress member to the north, she already left the district from my perspective. So it's a matter of, and you know, allegedly she's going to run for governor. That would be fine with me, to be honest with you, because I think Governor Hochul would clean up. But you know, that's a different day and a different dollar, and that's just, you know, I think Governor Hochul gets she gets a raw deal. She is the first woman governor, and I think some people feel they can take advantage of that. She is not outwardly. She works hard. She works around the state. She gets to little areas like Saratoga County, right, Martha? It's very, and I can tell you, my Rensselaer County and Albany County chairs are a little bit envious that the governor not once but twice has gone to their annual outing. But you know, she's probably just a little left to center governor. She's trying to do the responsible thing, and sometimes responsible is not glitzy, it's not sexy, doesn't get people's attention. But depending on what source of news people get, she doesn't get a good shake. She doesn't get a fair shake by any stretch of the imagination.
All right, our next question is going to come from Fred Floss. Fred, are you able to unmute and ask your question?
Hello, can you hear me?
Yes.
Hi, this is Fred Floss. Thank you so much for taking the time to speak to us. That means a lot. I guess my question, it's depressingly topical, but I was here to ask basically, what, if anything, can we do to prevent ICE from attacking and destabilizing our communities and exceeding the constitutional federal parameters that they're breaking?
You know, that's a very fair question, Fred, and I don't know if I have a very good answer. I'll give you, though, an example of what is happening and how people need to respond. On my street in Cohoes, I had 2 young men grow up, and they both grew up to be very successful in growing their landscaping business. And they're probably in their mid-30s now. They're a little Trumpian to a certain degree, right-leaning, conservative. They're business folks. But they have always employed dozens and dozens of undocumented immigrants to work in their companies. And last Wednesday, I get an emergency text saying, hey, Luis, our foreman for the last 10 years, the one who has always been bringing hardworking people here to work for our companies because nobody else will do it here, he just got picked up by ICE. Can you do anything to help him? And my answer was, give me a call. And the true answer was, I have no control over ICE. I wish I did. What's concerning me is that this heavy-handed cloak and dagger approach that they're taking is going to drive more and more of our hardworking undocumented immigrants into the shadows. And, you know, now ProPublica issued a report today stating that there is cooperation going on at the federal level with the IRS on those undocumented who have actually done the right thing, gotten a taxpayer ID number, and now they're going to be looking potentially to target to remove them from this country. For what reason? Not because they're criminals, but because they're undocumented immigrants who are here because of a failed immigrant. They're here for a new opportunity to protect and support their families, but their undocumented status has continued because of a failed immigration system for the last 40 years. And that is both responsibilities of both parties. It was only a year ago that Senator Schumer was working with Senator Langford, a ardent conservative, to come up with a concrete process to make sure the resources were there so immigration cases could be heard, to vet the individuals properly, to make sure everybody getting through is safe and ready to work. And the current president shot it down, saying he wanted to do it himself. And here we are, July 16th, and we're not even hearing a sniff of a solution. Because at the end of the day, and now they're starting to get it, and this is where his coalition is starting to fracture, you're hearing from farmers, you're hearing from healthcare facilities, you're hearing from the hospitality industry. They can't hire the people they used to hire, and it's having an impact on their businesses, our crops, our food sources, and by the way, for what it may be worth, it's having an impact on our taxable revenues. So, there are efforts out there. As you know, there's been mask bills introduced so that when people who work with ICE can't have a mask on and they have to clearly identify themselves. But to be honest with you, those bills are good in principle, but they have actually no effect at the federal government agency. ICE can do what ICE wants to do. We're not happy about it. What we've been doing in the legislature, and I've shared this on my social media at times, although my district is not heavily, not noticeably heavy with refugees and asylum seekers. We know they're there. They know they're part of the community. I know I work in the Hispanic community very closely with them, particularly in their healthcare needs. But we've shared with them the proper resources, what their rights are, what they can do, and what they can't do, to make sure that they know what their rights are. And we're working very closely with the Albany Law School Immigration Center, because we want to make sure everyone is got proper representation if unfortunately something has happened. I am hoping at some point soon that we start to see more cracks in the armor, and eventually common sense is going to have to prevail. To be honest with you, if the current president wanted to really establish a legacy that everybody could look to, it's taking that immigration reform bill.
No, you guys can come down and watch this movie. If
And
you get over here
Yeah.
and Bentley gets over there,
Yeah. So, if he
well, I
could,
don't care what you do.
yeah,
I want you to stay away from him.
Can we have a flyer?
he's muted. Okay. But if you're really serious about having a supercharged American economy, I would take that $70 to $90 billion dedicated to ICE and instead put it into establishing a true immigration judicial system so that people are properly vetted and can come in America and live in the broadness of daylight, not in the shadows.
Thank you.
Next question comes from Patricia Pfeiffer. Patricia, are you able to unmute and ask your question?
Hi there.
How are you?
I don't really remember my question. Do you have them listed there? I remember the general tone of it, but I don't remember it specifically. But
I have your question right here, Patricia, and if you want to expound on it in any way, but I'll just read it to you as a reminder. How does he defend the CDPAP program, taking away choice from consumers and the horrible rollout to the one provider network?
Yep. So first of all, CDPAP did not take away choice. Matter of fact, every consumer had the ability to keep all their caregivers if they chose to. The only thing that changed is who's processing the payroll. There's been a lot of misconceptions.
Excuse me, Assemblyman, when I talk about choice, not the choice of their caregivers, the choice of their FI. and
Right.
has always
Yeah,
been
right.
the ability to choose the FI. Now they're
Right.
forced to go with PPL.
Right, right. They are going to do it, and I'll be very honest with you. The state did a terrible job of allowing that program to grow out of control. Whereas most states have 1, 2, or 3 FIs, New York State had over 600. Now, honestly, what I'm most upset about is the independent living centers. They are the heartbeat of this program. They are the originators of this program, and they unfortunately have been relegated to second tier status here. And that's one of the things I've been pushing for as a correction, is to make sure they can still participate in the program. But to be very clear, we needed to have better control of this program. I can tell you firsthand, there was a lot of fraud going on in this program. I had a total of maybe 8 complaints in general, and a lot of people know how to get a hold of me. And the majority of complaints were from the workers who said, why am I doing timesheets? I never had to do those before. That is out and outright fraud, that they were never doing that. And that's a shame, because from my perspective, that's a violation of federal law. And quite frankly, the state could stand to be hit with a major penalty if that was actually going on. So yes, this has been very painful. There have been a lot of bad actors that have been spending over $10 million of your taxpayer money to try to protect their little golden pot of money they were getting. But at the same token, I can tell you there are a lot of people that hasn't skipped a beat. I hear from a lot of people that understand the program. And to be honest with you, the originators of the program have been saying for years, this needed to be reformed. This needed to be changed, because we're basically spending a lot of taxpayer money on the wrong thing. We're doing it on middlemen who don't have any part of care. And so, as much as I don't want to sound like I'm defending it, but I'm trying to explain it, because the reality is this: we're going to make some very difficult decisions going forward based on this lunacy of the federal government. It would have been even worse if we didn't touch this program. And it's kind of funny to me,
Assemblyman, just to jump in,
Yeah.
okay, because your response is the standard response about fraud, abuse, etc. And we know that the Republican side talks about Medicaid and the federal government. And what is their story? Fraud and abuse. So it's basically the same story from New York, fraud and abuse. We've done this because of fraud and abuse. But the fact of the matter is that the aged and the disabled lose their choice and are suffering for it. Now, a lot of people, I know you're saying that people are saying it's just running smoothly. It's not. Okay, I am a former employee of an independent living center, have been serving the disabled and aged for over 25 years, and have many associates and friends who use personal assistance, and they're not getting paid, and they're losing their
Patricia, if that is the case, my email is very easy to find. I will investigate every single case you send to me, as I've done, as I've said to other people throughout the capital region. I don't just relegate it to my assembly district. I did say earlier, the independent living centers got a bad deal here. They got a bad shake. And yes, you're right. I would like them to have the opportunity to do that. Unfortunately, the system got out of control for several years. This should have been changed in 2017.
Yes, but the choice of using PPL was not a choice. It wasn't.
No, you're right. No, the state went out and did an RFP. PPL won this. The state goes out and does thousands of RFPs each and every year. However, this one is, no pun intended, personal. And yes, this one did unfortunately give a bad shake to the independent living centers. I've worked very closely with the Columbia Rensselaer County one, the Hudson Valley Independent Living Center, which Denise has been running for years. And, I still communicate with them on a regular basis. We work through the issues. And yes, we're disappointed because it's going to have an impact on their operations. And we're trying to find ways to help them because they are the originators, just like CD Choices, which is the statewide one. But there are a lot of for-profit corporate entities, the same ones that Democrats usually like to complain about, that are using, hedge funds and other facilities and other resources. There's a lot of people who came in on this You don't see them because you're not aware of them. But this was primarily an issue that was out of control in the Bronx and in Queens and Brooklyn.
Hey, John,
Oh.
you're doing great. I'm just going to jump in here because I'm the delegated internet cop. Patricia, please play nice with the other kids.
She's okay.
And one
She's-
question to a customer.
No,
Okay,
she's,
go ahead.
she's passionate about her position. I respect that. And I will reinforce, Patricia, anybody with complaints not getting paid, I want to know about it. I have a direct line into the lead at PPL because I've made it my point to having to work with the one that was selected. I didn't get the chance to make that choice, but you got to work with what's there. Otherwise, we're not doing our patients' due diligence.
John, our next question is Benjamin McFarland here. If not, I can read off his question. But this has to do with the BBB's impacts on college and student loans and how the MAGA agenda is going to impact that for upstate New Yorkers. We have 2 college-age children. Can you explain the impact the cuts on federal loans and caps on graduate loans in the short term for students and long term for various professions?
So as I may have mentioned earlier, and I'm trying to actually find my notes right now. I had it and I lost it. Bear with me. What they do is they cap the number, the dollar amount of loans that can be taken out by individuals. And let me get the numbers up real quick. I'm just pulling them right, almost there. So bear with me. So first of all, and as you know, every field has its own acronyms, but programs that for loan repayment known as Save, Pay, and Repay are now going to be eliminated by January 1st, 2028. There'll be no deferment for unemployment or economic hardship for new borrowers after July 1st, 2027. But they're going to be putting caps. Graduate loans are going to be capped at $20,500 annually and $100,000 total for graduate students, or $50,000 annually and $200,000 total for professional students, whether it's engineering, whether it's medicine, whatever it may be. Parent Plus loans are going to be capped at $20,000 per student annually, $65,000 per year total. The bottom line is, and this is a terrible thing to say, and listen, I'm lucky. I grew up in a middle-class family. I worked since I was 10 years old. I was actually able to pretty much pay my way through school, but I was able to take out some loans to do that. My mom and dad didn't pay for my education. That's back when education wasn't that bad. Now it's a lot more. And what they're trying to do is defer people to go on to higher education. That is my fear. And that's a terrible, terrible situation. And don't get me wrong, there are many people where higher education is just not their cup of tea. The building trades is, and we're working, and we support thousands and thousands of programs to help individuals. They want to get into the building trade. They want to get into healthcare at a different level without going to get the degrees, whether it's food services, whatever it may be. You know, we're not trying to be a one size fits all, but this is definitely an effort to eliminate higher education. And as you know, this administration and the Republican Party has been extraordinarily unkind and actually, to be honest with you, abrasive towards schools of higher education. They look at them as being liberal labs. And quite honestly, that's not what it is. What it is young people learning, getting excited about what opportunities are there, and for them to come out and be a part of the workforce. And this is their way of actually, in my perspective, dumbing things down a little bit. It's terrible. It's going to lead to workforce shortages even more, which, by the way, leads to less taxpayers. And less taxpayers means there's going to be enough people contributing into the system to support the people who earn their hard-earned Social Security going forward, and also their Medicare.
Our next question is Catherine Davidson here from Saratoga Springs. Catherine?
Yes, I'm here. I think I've changed my question because you've answered a lot of things. My 2 primary concerns are climate change So, I'm hoping that New York State can make up for some of these federal cuts. But the other one that I'm really hoping that the blue states can introduce legislation to stop these masked men from seizing people off the street. I feel like it's extremely dangerous. I don't know why anybody should submit to law enforcement if they don't identify themselves. We could be submitting ourselves to serial killers. So
No, I mean, classic example, two of my colleagues in the Minnesota State Legislature had somebody knock on their door and parading as an officer with a mask on, and one was killed and the rest were shot. As I mentioned earlier, I don't know if you were on, but legislation has been introduced in New York State. It's been introduced in California. The question is going to be is it legislation that can actually have an impact on federal statute? That's going to be the challenge. And how does that work? So even if it's successful getting passed, it may be subjected to a lot of litigation. But obviously, as you know, federal administration is not shy about being in the courts by any stretch of the imagination, as they try to stretch the original boundaries of the executive.
Thank you. And the second question was about the climate change. What can New York State do?
Yeah, I mean, New York State New York State has been moving along, not as quickly as we all like, but unfortunately, when these energy tax credits, particularly for offshore and onshore wind, are being taken away from us, it's going to make the projects that are already upside down a little bit more upside down. So, as you know, Norfolk, the one out in Long Island, is up and running. There's another one at Brooklyn Yards that's underway. That's still in place, so that's a good sign. Here closer to home, myself and Member Fahey, now Member Romero and former Senator Breslin, were advocating for some other offshore efforts because of the fact that the manufacturing facilities will be here in the Port of Albany, which will brought hundreds of jobs to the capital region. So we're going to keep pushing for that. We've got about $1 billion set aside for these initiatives, and we're trying to see if we can find some willing partners. As you might guess, it now gets to be a point of, you have these corporate entities that are trying to look at business decisions. And to be honest with you, as a business person, you tend to look at things on the 3, 5, and 10-year horizon. Honestly, every day, things change on 15-minute increments. This morning, we thought that Jerome Powell was going to be fired. And then he wasn't. And then he might be. Now they're denying it. And it's really a matter of, it's very difficult for, I think most of the larger businesses and industries have chosen to ignore whatever is being said. And hopefully, we'll get through this sooner rather than later. But New York State will continue to make its investments to try to help meet our goals.
Thank you.
Patty Morrison, are you here? Patty? Well, Patty's question is, what is the state doing to keep the same level of Medicaid we currently have so nobody loses? And what does the big beautiful bill mean for our everyday kind of health expenses, co-pays, prescription drug costs, things of that nature?
Well, the interesting part is the health plans have enjoyed great subsidies from the federal programs, and that's been allowed for them to offer reasonable programs to everybody. And it has actually had an impact on co-pays, deductibles, premiums. We don't know what the impact of that's going to be. What we do know is that individuals making over $35,000, $40,000 a year that were qualified for actually affordable, if not free, health care and in a good bronze level package are probably going to lose that now. But this will not be lost technically until January 1st, 2027, after the midterm. So we need to do a better message, better effort of really conveying this, of what's been passed that they may not see the first of this year, but we'll see the first of next year. And like I said, a lot of working families are working and they've been able to have the benefit of affordable, if not free health care. And they're working. They're not sitting home eating bonbons, as they used to say back when I was a kid. They're working and working hard. And now they're going to be punished, not penalized, punished for working hard, because of a program that was actually running a significant surplus because we were covering people and promoting wellness. And now we're going to be regressing. Either they're going to be paying a lot out of pocket at the counter and on premiums, or they're going to go without coverage, which is even worse. You know, our biggest problem in the healthcare system is it's called a healthcare system. It means you're going to provide care. We should be providing healthy options and healthy lifestyles. And we were moving in that direction. And now this is a major setback.
Max, did you have a question or a follow-up question?
I have a question, but I've also gotten a couple of texts from people who are trying to chat, and it says chat disabled. So I don't know if that is something that's across the board. I have gotten a couple of texts. So if you want to ask a question or you know, say something for the moment until we know if it works, you might raise your hand instead. And my question would be following up, you know, I'm just trying to get a handle on what this will look like, John. If you know, we talk about nursing homes closing, hospital closing, and you know, so where does New York State come in? What does it look like when grandma gets kicked out of the nursing home? You know, is she going to find her a place under a bridge for a hospital bed? You know, I mean, you know, it seems like.
Let's step back. Let's step back a second. There's two things. One, the unpopular thing to say is New York State is not going to be able to backfill every single issue. We're going to have to look at things on a case-by-case basis. Number two, though, why are they closing? They're closing because of the fact that we can't, and because of this failed, actually, not only because of the failed immigration system, but because of the terroristic tactics being taken by ICE, we're going to have less and less people willing to work in those nursing homes. You know, if you've been in a nursing home, you take a look around. There's a lot of people working there that are doing God's work. They don't get paid a lot. A lot of them are here to work from other countries, and slowly but surely they're going to be disappearing. That is what's going to lead to this. And to an earlier point made by somebody, a nursing home in the North Country is going to struggle, and families unfortunately are going to step up in many circumstances. One of the biggest dynamic changes between upstate and downstate New York. Downstate New York has no problem with getting people to work in hospitals and nursing homes. We in upstate have a workforce shortage. That's why I've tried to move away from the traditional Medicaid policy of getting funding for hospitals and nursing homes and focus more on an economic development perspective and look at it as an investment in workforce training to get people into decent paying jobs.
Thank you.
John, are we finished with all the questions, or did you want to continue?
We have a few more questions. I will say, if we'd like to make this a little bit more interactive, the chat does not seem to be working for those of us who are not hosting.
I need to jump in here. There's been a change to the chat format since last night and today. There's been a change, and they have buttons along the top here. Okay, if you go to the chat window and you have to click the button, whether it's everyone or Max or John or, you know, whatever, and it is working, but you have to click the button. The format's been changed, so it is working.
So if you do have a question, the chat is working.
And click the everyone button. Click the blue everyone button on the top, and it should work. In fact, I'm seeing people's chat messages.
Yeah.
I've been receiving chats. I've been receiving chats all along.
So the next question that I had was from Dylan Spring in Troy. Dylan, are you here? Dylan's question was, why did you co-sponsor New York for All in 2024, but not in 2025?
To be honest with you, every 2-year cycle, at the end of the sunset, I take myself off all bills. When a member sends a circulation bill around that updates the memo, I will consider the bill. I have not seen a circulation memo on it, so I haven't discussed it. I haven't gotten onto it.
I accidentally muted myself. Our next question is from Alvin. I'm sorry, not Alvin Gamble. Is that all the questions? Did we make it through all of them? I have a question. What, John, keeps you hopeful and motivated and optimistic? Obviously, we are all scared. We are all uncertain. We don't know what's going to happen to the healthcare system over the next year. What keeps you motivated? What keeps you working? And what keeps you sort of optimistic and hopeful?
Interestingly enough, that interaction I gave you from my neighbors from this past week, these are, you remember one thing, 41% of New Yorkers voted for what's going on in Washington right now. That's a blue state, and 40%, 41%. That's a fact. It's not an opinion. It's a fact. But what's happening, which is not a surprise, is all of a sudden people are saying, whoa, this isn't what I voted for. I don't like this. I'm opposed to this. We're seeing nationally, even in the reddest of all states, and not near the borders, but in the heartland, that they are opposed to the aggressive tactics of ICE. And you know what? Once that momentum's going, that's giving me a sign that, you know what? We're starting to see the public's opinion change. And our job is to continue to focus on these issues and provide sound solutions. That's what people want. At the end of the day, yes, there are going to be partisan folks that are going to be either far to the left, far to the right, far to the middle, whatever you want to be. But at the end of the day, the normal person cares about mankind and wants to see solutions. And we need to provide solutions. We need to show that the fact that they expanded in perpetuity tax cuts for people making hundreds of millions of dollars per year was a wrong decision when it's leading to Granny being thrown out of the nursing home, as Karen has says. And no, Karen, we can't send her to Mar-a-Lago. I don't think it's an insult to send her to Mar-a-Lago. Why would we want to do that?
Danielle, are you able to unmute and ask your question, please?
Hi, good evening. I just had a really quick question. Can you hear me okay?
I can hear you fine. It's about Medicaid cuts to drug treatment facilities, right?
Absolutely, yes.
No, I'm very concerned. They don't define it clearly because I think they're afraid to, because once their base finds out that, because guess what? Substance use disorder does not pick whether it's a Democrat or a Republican or a conservative or liberal. It happens to everybody. And I can tell you that for a fact. That's been one of the areas I believe I've worked hardest on in my 13 years in the legislature. A lot of these facilities are actually managed by healthcare systems, which have the hospitals and nursing homes. So maybe not directly will have cuts, but indirectly it will have an impact. And by the way, indirectly it will have an impact on those people who work in those facilities. Because once again, there are undocumented individuals who have been longstanding members of our community that are being swept away suddenly for no good reason. So I'm very concerned about it. You know, we've worked hard over the last 20, 30 years to reduce the stigma on mental health and substance use disease. You know, now we have individuals who are struggling with disease. We don't call them addicts. We call them patients. And we look at it from a healthcare perspective. And we've got to find a way to help support that, because we need those people back contributing to society and being productive members of our community.
Evelyn asked a question in the chat. Can the state do anything with National Grid to help out folks who are going to lose HEAP?
Yeah. So it's not been clear on what the HEAP impact is going to be. Matter of fact, you know, there's been a lot of discussion about different energy bills like heat. New York heat. We did pass at the end of the session a bill to discontinue the 100-foot rule. That's going to return about $300 million to the taxpayers, to the ratepayers, through the various utilities. That may be a drop in the bucket when you look at the overall cost. But, you know, from a heat perspective, we need to do a better job of actually encouraging people to sign up. Many may or may not know, last year I worked with ARP to pass legislation that requires every EPIC recipient, so those individuals with EPIC 65 plus who have an income below $50,000 a year, are to be sent a mailer encouraging them and sent information on how to sign up for HEAP. 1 out of every 3 individuals is eligible for HEAP, and 2 out of every 3 doesn't sign up statewide. So we need to do a better job of educating them. However, once again, we've always funded a lot of programs to help with our not-for-profits in our communities to educate people. We got to try to maintain that funding.
Quincy, you may unmute. Can you ask your question, please?
Yeah, if I can remember how I wrote it.
Well, I see it right here, Quincy, about basically the actual
Well,
date.
let me see if I can explain it.
No, I know what you're saying. Basically, are we going to be able to show when the dates of this big bad betrayal, HR1, big beautiful bill, whatever you call it, to understand when it's going to start and how the impact's going to be? Your commercials come September, October, and November next year are going to be off the wall, explaining that message very clear, if not sooner. It's got to start sooner.
Yeah, that's what I'm trying to ask is there a consistent messaging that we can do out of our county Democratic, and this is just focusing on the Democratic part of this, so that we can start providing consistent information that is factual through the network that we have.
Yep.
That gets circulated way before those commercials start, so that when those commercials start, people will go, duh, I already knew that.
Right. You want them angry in April, not in November. I got you. I know that the party will be working on messaging that can be sent downstream in an early basis. In all fairness, and you hit on one of the key words, factual. That 975-page bill that hardly anybody looked at when they voted on it is being digested by word to make sure we can actually demonstrate exactly what the negative impacts are going to be and let the public make a decision on that.
John, can you address Danielle's point in the chat? Do you think that the federal government will change how methadone is distributed to patients who suffer from addiction in the near future?
I don't know about that, Danielle. There's one aspect that talks about actually allowing methadone to dispense at pharmacies. And I think there's still a mixed review on that because successful treatment, yes, it does include medication like methadone or Suboxone or naltrexone. However, at the same token, the proper counseling needs to be part and parcel. And there's a fear that if there's a separation from the system, that counseling may be lost. So I think time will tell on that. I know one thing is that they are starting to expand. And I think that where we really might want to focus our efforts is for people still to be going to the outpatient clinics. But, once they've built up a relationship with the provider, to be able to move them from getting, medication every 2 days to once a week or maybe every 2 weeks and do that. Because, the reality is this, there's a lot of people going to treatment programs and still are trying to work and hold down a job and support their families. And when they're on methadone, that gets interrupted and it has an impact on their take-home pay.
And then Max put in a follow-up question. Can you speak to education, whether the state can step in to provide some of the services that reduction for special ed cuts? This is pertaining to me as a local music teacher. And will our property taxes go up due to the federal cuts in education?
Well, it's kind of interesting to me, and maybe somebody can shed some light to me. If you remember, those running that are now in charge ran on the fact of all these states doing their own little thing in education. I would have thought there would have been an effort for the federal government to take over the education system. Instead, they're dismantling it. So I'm scratching my head figuring out what the heck's going on. The state always values education and healthcare as its number 1 and number 2 items. We're going to do our best. One of the challenges we have is, because family size is continuing to decline, less and less children are in the education system. So we've got to figure out how to do this because it's not as if you lose a couple kids in a school. You take Waterford, you lose 1 or 2 kids in K to 12. well, 1 or 2 kids in a classroom, you're not going to change things too much. If you took 25 kids out of a classroom, that would be a whole different conversation. That's not happening. So we got to figure out how we're going to be able to continue to support our education system. As you know, today the controller released next year's tax cap. It's going to be 2% again. That doesn't provide a lot to our friends in Waterford. I think it's about $58,000 if I remember correctly. So we got to figure something out.
And can I ask what advice you have for sort of a younger generation of Democratic leadership who are getting involved, still trying to kind of navigate the bells and whistles of the New York State political system? What advice do you have for us? How do we fight this, and how do we, make it to lessen the impacts of this bill and of the MAGA agenda as little as possible?
Well, first of all, thank you for participating. That's important. Number 2, you need to be active, and we need to be evidence-based. Now, everyone has different styles. People know me, know I'm not bombastic. I don't come out with outrageous comments. I'm not screaming at the TV whenever you see an interview. That's not my style. As a rule, pharmacists try not to yell at their patients when they're trying to encourage them to comply with a medication. That's just a good thing. Everyone has a different style. However, more and more people now are turning to social media than ever before for their news. And there's a lot of misinformation out there. And there's nothing wrong with having a balanced conversation about that issue is not accurate. And here's the facts. And it goes back to what Quincy said or Renee said earlier. We need to make sure we have our facts first. It's incumbent upon the party to share that information. It's incumbent on young and seasoned members to make sure they're ready to receive that information and to share it accurately, and to reach out to elected officials like myself to make sure you got it right. And I think this format's great. I'm hoping this isn't a one and done. It's a continuation. And I think it's a great opportunity. And we ask you to continue to still be involved. Show up at the events. Start carrying some petitions for Democratic candidates. There's nothing wrong with that. It's a good thing. It's a good way to meet your neighbors. I feel bad for the youngest generation. They've grown up looking at this thing and texting and don't have eye contact. We need to make eye contact. And listen, as much as I would rather be in person having these conversations, this is actually a nice structured format because everyone's been able to ask any question they want. They've been able to use whatever temperature they want to ask that question, but I can still see a lot of people. And they've been kind enough whenever they've gotten on, if they had the ability to put face to face, they've done it, which I think is important. That's an art that makes a difference. And for those people who are young that like remote work, I have to tell you something. Remote work sounds great, but as more and more stories are showing, show up to the office 3 to 4 days a week too, because the bosses notice and they develop relationships. Goes a long way.
Have you received any concerns from your Republican local colleagues who think that this bill may impact their districts? It seemed like there had to be a lot of strong arming behind the scenes to get some Republicans to vote for this. What are you hearing any concerns from them?
Well, I don't hang out with Elise Stefanik and Mike Lawler, if that's what you're asking me. I know them. Mike Lawler served in the assembly with me. I'm actually shocked at his votes because he actually tries to pretend to be a moderate, but obviously that's not the case with here. I'm surprised with Andy Garbarino on Long Island, who's a good friend and a colleague, but these guys are under a lot of pressure because, interestingly enough, it's because of Twitter, right? You get Charlie Kirk fired up and they start going after them with things. It's government by threat, which is really sad. I mean, that's why we actually broke away from the British, if you really think about it. And now we're seeing a revival like on none other. So I can tell you that my colleagues in the Republican Party in the Capital Region, they've got nervous grum bellies. They're upset. They know this stuff does tend to just trickle down.
Mary, you have your hand raised.
Mary Pliska?
Pliska. Yeah, and maybe Mary Lavera wants to say something too, but I was just thinking back to what you said, John Lacombe, about young people in the Democratic Party. And in this whole discussion of everything that the Republicans have been saying about budget cuts and all that, no one has mentioned younger families really. And I have some good friends who work in daycare, and I'm wondering how these budget cuts are going to impact on New York's ability to have, because I know there's already a shortage of daycare for families with young children, and I'm wondering how this is going to impact on all of that. If there's
So,
any
yeah,
thoughts on that.
good question, Mary. You'll hear from the Republicans that they extended the child care tax credit. And they might even have expanded it by $500 or $800. But, from $2,000 to $2,500, that doesn't cut it for child care. We're continuing, we're continuing to support educating individuals to be in the child care arena. We continue to provide capital funding. I got to tell you, the governor has been very good. Granted, we did get some money from the federal government, but we're putting money into fortifying the workforce and presenting more opportunities for child care to be accessible. And we're trying to make sure that those who can least afford it and are making those living wage jobs can still work too.
Tony, you had a few comments?
Yeah, I just wanted to thank John for his generosity and willingness to show up and help us. I think the answer to a couple of questions is support your local Democratic committee, support whether it's a town or village, because it starts with the grassroots, support your county Democratic organization, learn the ropes, pay your dues, and then, if and when you're ready, run for office, because we need new blood, like I said, unfortunately, tonight there's a lot of old Demosauruses like me on, which is a good thing. We're still alive and breathing, but we need lots more new young faces, stepping into the breach. And I just want to make a pitch for the Waterford Democratic Committee. This is the first of town halls that we're going to be hosting. We're going to have a labor in the Skunk Works is a labor caucus, which will be a town hall. We're going to invite local labor leaders to a town hall. We're also going to have a women's caucus, so maybe us boys won't be invited. But discussing reproductive rights, ERA, and all that good stuff. We'll also be talking about legal issues, especially with ICE and all that other stuff, and how we can protect and defend ourselves. So, guys, this is my little pitch for Waterford Democratic Committee. Come and join us. It's going to be fun. Bless you all. Thanks a lot, John.
And
My
with
pleasure.
that, I'll formally thank on behalf of the Waterford Democratic Committee. John, thank you so much for showing up. Thank you so much for your insight. This was exactly what we needed it to be. The entire mission around this was how are federal policies going to impact you, the average upstate New Yorker, negatively mostly, because there doesn't seem to be very much in this bill that's going to have any positive impacts. John, any closing remarks?
No, I just want to thank you all. Your questions were great. Listen, there's easy questions, there's difficult questions, but we can have a civil conversation. This is what our Constitution was meant to foster. Unfortunately, it's being lost at times, and it's being lost with yelling and screaming. And the other thing I want to just pick up on one of Tony's last comments, you have the ability, and Martha knows this, to participate in the statewide convention. You guys have your own state representatives that can run. Let's get signatures. Let's get out there. It's interesting. I come from Cohoes. It's a very democratic city. It's a little bit different. There's some similarities with Waterford, to be honest with you, but there's a lot of, when you get up on the hill in Waterford, it gets a little bit different. Young people need to go out, do some door to door, and say, here's why I'm running to be a state representative, whether to be on the election committee or the state committee, because that way you have a voice at the state parties nominations as well, which is important because that focuses not only on who's running, but also the policies they have. But you also build, and Martha knows this, greater relationships with other similarly situated individuals throughout the state. Thank you very much. I appreciate it.
Thank you, Tony, so much. Tony, Max, everybody Martha, thank you so much. Everybody that came in, everybody that took the time and effort, that asked questions. And first and foremost, thank you so much to John for showing up and sharing your expertise and your insight. Thank you.
Thank you. Have a good night, folks. Stay cool.
Thank you, John.